back to InjuryGuru.com. I'm Carla Schimmelfinnig, registered physical therapist, and this is the fourth exercise, but the fifth video in the hip replacement exercise program. So this exercise is one of my favorites. A little bit harder to grasp for a lot of my patients, but since you have the video, you can just watch that video over and over again until you get this one. The other thing about this exercise, because I'm talking to you and you've had a hip replacement versus some other diagnosis or other problems that I would use this exercise for, but because you've had this hip replacement, you need to make sure that standing on that operated leg is comfortable. It's not causing you sharp pain in that hip or into the groin or thigh. So as long as you can do this exercise without that type of pain, then you can do this one. And this is just called a side reach. I want you to have a chair next to you, or you can do this next to your kitchen counter or a kitchen table. This is the starting position. So I'm standing on my operated leg. My good leg is just bent at the knee with my toe resting on the ground. This is called my reach leg. So this is the leg that's going to be reaching. This is the leg that's bending up and down and that I'm standing on. Operated leg, my good leg. And it just looks like this. This is called a side reach. So I'm reaching my good leg to the side like that. Now, when I reach to the side, I want you to make sure that your toes are staying as close to the ground as possible. You don't want to touch your foot down here, but you can touch it back here in this starting position every time if you need that for balance. You don't need to hang on to the chair or the counter unless you need that to keep your balance. You want to reach as far as you can without causing pain in that hip and without losing your balance. So if you're reaching this far but you continue to lose your balance, then that's just too far. You need to shorten that reach a little bit. So maybe just reach that far. Right? And that's just how you can modify it or shorten that reach. Let's see. I want you to do three sets of 15 repetitions of this exercise. So this is 1, 2, again I'm touching back here for some balance, trying not to touch my foot out there. That's 4, 5, and so on. When you do this exercise, you are really going to feel some fatigue in your quad or the muscle on top of your thigh and even along the side of your leg, which is where we want to feel it. Those are some of the great muscles that you need to be working and getting stronger. This exercise kills two birds with one stone. It's another reason it's one of my favorites. It works on your balance as well as your strength. So most of my patients enjoy doing this exercise. You can really see the improvement from when you start and when you finish. Another good thing you can do is compare this to the other side. So you just want to turn around or move your chair, stand on your good leg, and then your operated leg becomes your reach leg. Just so you can see what normal is, how strong that good leg is, how strong the muscles on the front of the thigh and the glute muscles or the rear muscles and on the side of that leg, how strong they are and how sturdy that feels. And that way you can compare it to your operative leg and you have a good goal. You know what to work toward. So again, 3 sets of 15 repetitions, and you can take a 10 to 20 second rest in between each of those sets, at least once a day, but if you can get this in